everyone. Welcome to Health Impact Digital Health Talks. This is Megan Antonelli, and I am here with my friend and colleague, Janae Sharp. Hi, Janae.
Hello, how are you?
I'm good. We are here 1 week before Health Impact, a couple weeks into the month, but yet it is almost the third Thursday. In fact, it is the third Thursday of January on only just the 16th day. I don't even know how that happens, really. It's math I can't even fathom.
Yeah, it still feels like 2018 to me. So I feel like time is a construct, but we get
It
to
is
talk
a
about good
construct.
things.
It is a construct, and it is not our friend this month, this week, or maybe even this year. But we had a great show today. We've had a lot of good interviews, and we're here to talk about five good things. But I can't really begin to talk about what's going on and the good things until we at least talk a little bit about the fires here in California. And of course, I had a great conversation with Ray Lowe from Altameda Health System, and they had a clinic that shut down and was lost in the Eaton fire. And of course, so many of us have friends and loved ones who are being impacted. So our hearts are with them, and really just appreciate all of the first responders and healthcare organizations and individuals who are just doing so much to help all of the people here in Southern California. So
Yeah, that's right. You're in your neighborhood. So, and we will be sharing resources of things people can do to help. I know you've posted about that, about some things, and we have a lot of connections and colleagues who are really in the thick of it in healthcare, providing services and helping people who've lost their homes, and thinking
yeah,
of you
I mean,
guys.
it is so hard to fathom. And obviously, as you begin to think about, which is they're still burning. So, thinking about rebuilding and all of that. But I just think about the kids who have lost their schools and the mental health ramifications there. And of course, we spoke to our friends and charity partner for Health Impact Road Recovery today about, they're already initiating programs with, musicians here in Southern California to help those kids as they kind of deal with the stress and the emotions from this, because it is, not only, I know it's been 5 years since the pandemic, but let's face it, it's still, it's still fresh in our memories.
Yeah,
And,
kids have still really been impacted by that.
yeah. And the kids were so dramatically impacted, and now this, and, and it's not just, I mean, this fire is huge and significant, but there's just been so much of these types of, you know, tragedies happening. So it's just it's a lot for those kids to deal with, especially since we can barely deal with it ourselves, right? So thankfully, we have a lot of mental health and healthcare resources to support that. But as we look at, and then just to talk about also that what on the session that we have this week, which we're excited to get planned around kind of sustainability and the environment, and the importance of that. So all the hospitals that are working towards that, and we've got our friend Kamal Bajaj and some other folks speaking about that at Health Impact. So it's such it touches every part of healthcare, and luckily there's a lot of people doing good things around it. And as the quote is, look for the helpers in all of this. So we continue to be grateful for that.
Yeah.
So as we look at our five good things, which we didn't, the world didn't have much time to put them together because we are only 2 weeks into the month, really. But I'll tell you, HHS was very busy at the end of the year, so they have made our top two or three here. Most recently,
Yes, they're big changes. And
yeah,
we want to thank Mickey Tripathi and say we will
yes,
miss you,
we
and to keep us
will.
updated on what comes next.
I know. No longer a Vassar grad at the top of ONC or ASTP, as it may now be called. Do you think are they going ASTP or ASTP?
We can call it whatever we want. It's going to
That's
be
what,
like me dead naming Twitter.
right. We can ask Stephen or Stefan, depending on who you are and what day it is.
Yeah, we'll ask both. I'm honestly glad that we have both represented in government right now. So that is one good thing. But I mean, we can also talk about they hired 3 new women. There are a lot of things that we'll be able to talk about for good news from HHS and from that group. Why don't you start?
So Megan Dirks is their Chief AI Officer. So they've hired a Chief AI Officer, which I always find to be an exciting title. And she's got a great background. And Kristen Honey, Chief Data Officer. And of course, Steve is going into the Principal Deputy Assistant Secretary. I'm not sure if that's been his role, but he is up there in the top of the leadership now. And then the new CTO, who is her name, another woman, which is very exciting, Alicia Rout, I think. I don't know how you pronounce her last name. I'm not winning on my pronunciations today, but great new additions, really great experience. And we're so excited to see what they do. But of course, I think prior to their getting there, there were even, they had their released their AI strategic plan, sort of the roadmap for the use in AI at HHS and public health. So that was a great thing to see.
Yeah, and I think that's significant for healthcare, like finding guidelines and important guidance about AI with the acceleration and how things are heading in healthcare. That's going to be significant to our lives. It's already impacting patient lives now, and it's impacting us day to day. So I think some of that, the challenge in that we're seeing right now is the speed of development of those, and like the challenges and threats that can face to people's privacy, their health, to every aspect of their lives. So FDA has tentatively approved some devices. So maybe we should start. Should we start with devices like the
and then the
guidance?
FDA actually released their draft guidance for developers for AI-enabled medical devices too. So in addition to the strategic plan, they've got this guidance that's open for public comment through April 7th. Around, that really touches on the entire product life cycle, I think, or, of medical devices, going into transparency, bias, risk management, all of that. So really important stuff, that we talk about all the time at HealthIMPACT. And I think a lot of people have been waiting for that, right? And there's so many organizations that are coming up with kind of voluntary guidances and things like that. But at the end of the day, the FDA is, and their word on it is going to drive how folks are able to bring these to market.
Yeah, so we'll ask people, they do ask people to leave comments. Also on February 18th, they will have like a webinar to talk about AI guidance. So if you're in healthcare, you should attend that. And I think it really talks and is relevant for our topic of the hospital at home and the expanding nature of healthcare. As each hospital room might have as many as 20 connected devices. And then when we expand to our homes, you can have lots of different devices, and the security of your information and your healthcare is critical. So I'm glad to see them really prioritize this space. And I think it's something that our audience really can speak to. Mm-hmm. There's also a session next week where if people want to learn more, they could come to it.
Absolutely. And we will have some folks from HHS attending and certainly there. So, and to go back to Mickey, and if anything, the sort of legacy that he's left, other than all of these roadmaps and plans for around AI, certainly is TEFCA. And I think we've seen a lot of activity there at the end of the year, particularly around the prioritizing AI and TEFCA to, ensure that healthcare is moving in the, most efficient manner, and the data infrastructure and interoperability is there. Yes. So lots of good things from HHS and
speaking of last year, at the end of the year, they had the acute hospital care at home waiver that dealt with telehealth and being able to give people care in their homes, and that waiver was extended. So this is something that's really relevant. Being able to give people care in their homes, being able to bill for the care that you're already giving, and being able to provide the best care in the best place, that hasn't always been reimbursable. So the extended waivers are extended, I think, through 2029. Is that correct?
I think actually only 90 days, but I am not sure. I thought it was March of 2025, but I think
okay.
Again, it's a silver lining of the pandemic, right? Is that we came away with all of this, the framework for telehealth reimbursement. And, we want everything else to go away, but we really want those to stick around because we like healthcare at home. We like those programs. The hospital at home programs in particular around Medicare, are really showing value, and the hospitals are, building out departments to support that. We also have sessions on that next week at HealthIMPACT. And there's a whole, there's an entire market of devices around remote patient monitoring that are developing, and that are doing incredible things. So to turn the book back and to go backwards when we've made so much progress on this would be a real shame. But I think there's, this was in fact part of, part of the bills at the end of the year to keep things open around the government and financing, and it kind of this slipped in. So hopefully
slipped it in.
Yeah, right. Hopefully it's prioritized and certainly extended through much longer than March.
Yes.
It is a good sign. And,
yeah, we have these temporary measures. We also have a lot of groups that are moving towards leading in that area, towards improving digital health. So one of our things for good news was Rice and Houston Methodist developing the Center for Neural Restoration and some initiatives about digital health.
Mm-hmm. Yeah, I mean, I think we've seen a lot coming out of Houston Methodist with their innovation center, and I think towards I forget when the news came out, but a digital health institute around.
That was 2022. Deep in the heart of Texas, they're doing some things besides just having lots of hurricanes and doing whatever it is people in Texas do really big. They're doing digital health really big.
Yes, absolutely. And so, I think they've, and this, it's always good to see partnerships and collaboration. So with Rice and Houston Methodist down there at the Texas Medical Center, although I think that, I know that the ION is not there, but that it's not far, but those two health systems are part of that. And they've launched this program, which is, around expertise in engineering and AI to enhance patient care. So it'll be exciting to see what comes through and what comes out of there with all of our friends down in Houston and that Texas area.
Yeah, I'm thrilled to see people with better outcomes, and we need them.
We sure do.
Let's talk about other good news. What else is good?
So another conversation we had today with Nora LaTorre from Eat Real about food as medicine. We will also be talking about that at HealthIMPACT next week, which is amazing. And RJ Biscone and a few others. We have Megan Reed from Northwell who are going to talk about the programs that they have in place. But just today in the news, the FDA has banned the use of red dye number 3 in foods. So I talked to Nora about that, and she was, their group has been actively involved in that, and just, in general, getting processed garbage out of school lunches and away from our kids. And here we go. Some good news again from the FDA. The government seems to be busy. I think they might be trying to get.
They've been working. They've been working during the weird dead zone between Christmas and New Year's, maybe. It looks like it. And I think this is thrilling news. Like, I have a kid who has an allergy to food coloring. So I've learned really early that it's in so many weird foods that you wouldn't think. Like, I didn't know they put red food coloring into meat. Like, I didn't know how many things we're just putting dyes in there so they look better without thinking about the health impacts. And this is great news. Like, it's great news.
It is. It is. And
Everybody.
the work that Nora is doing over with Eat Real around the Eat Real certified program and getting those types of, good foods in schools. I encourage everyone to kind of reach out to her and go visit their website to learn more about how you can get your school involved. I certainly am planning to do it once people are paying attention to that again, instead of everything else that's going on here in California. So good thing.
Well, it's important to pay attention when everything burns down, but long term, it's also important to have healthy foods and to talk about how our environment and healthcare impact our health and to plan for that.
It can't be emphasized more how connected all of that is, right? Right. And so good stuff. And then there was also news, I think some proposed rules out of the FDA around food labels, as well as
just imagine it. You walk into the store and you look at your favorite box of Lucky Charms, and it says right on there just how much sugar is in that box. And you know what? My mom, she told us every time, but not everybody has the mom who's going to tell their kids exactly how much sugar is in it. My kids don't have that mom, but now labels will be available for everyone to see.
Yeah. And another good thing that, of course, hits my heart and probably, my body in a little bit of a bad way.
Was I'm sitting here with a snack.
Right. Well, oh no, that's not a good snack, Janae. There's red dye number 5 in that.
Yeah, this has red dye and sugar.
Yeah, for those who are not watching us on video, she is holding up a pack of Nerds.
Red Nerds.
Red Nerds. So they will be worth money in a little bit. You'll be able to.
Yeah, you guys, I have a couple more. I'll be able to sell those on the black market.
Sell those on the black market to my kids soon. But the other good thing to think about, is it a good thing? It's a good thing because it makes people do the right thing and hopefully drives behavior change in the right way. It was the announcement around our, other favorite topic is alcohol and how it, causes cancer and shouldn't really be something that we're drinking. And I think that education is an important part of.
I missed that announcement. I don't really, doesn't really apply Wait, they said alcohol is bad for you?
Wow. Did. Can you imagine? I mean, who knew? But
I better not Google that. I'll get weird ads for the rest of the year.
Yeah, don't Google that. It's not necessary. But it is, there's a lot of good focus being placed on what we put in our bodies and how we need to be a little bit more aware of some of the things that aren't very good for us that we do anyway. I mean, there was an interesting article. I think it was in the New York Times around Make America Healthy Again. And it was basically like, when was America healthy? We've been a group of smoking, whiskey drinking Marlboro men for a very long time. What time are we talking about? When were we healthy? And I think it's a very, very valid point. But education is the first step in getting us to a place where we are not a bunch of drinking Marlboro men and women. So moving in the right direction. Well, I have all of the panel prep calls scheduled, and I've started talking to folks. And, we have Chelsea Clinton coming and interviewing 3 of the companies that are part of her VC firm, Metrodora, which will be a great session. Then, of course, we have Ed Marks and our friend Grace Cordova, who will be talking about the patient experience and, where that, what we can do to improve patient experience, because we give it a lot of lip service, but what can we do as healthcare executives to really make an impact on that experience? And then what I may, last but certainly not least, but I am very excited about is we have Simon Kirk, who's on the board of Road Recovery, who will be doing a performance and giving us a talk and talking about his experience with Road Recovery and working with these teenagers and helping them on their journeys in mental health through music, and also singing some songs to us there in the Microsoft facility in New York City. So I hope everyone will join us there for what promises to be another great health impact.
Yes, I think it'll be great. I'm looking forward to it. That's our biggest big news. Next week, we will be in New York. And the thing that I like about our good news and about next week is seeing people, including with road recovery, seeing people that are making positive changes in a practical way. And I think some people get caught in the trap of all these horrible things that are happening and forget their individual power. We are all able to do great things. And there are a lot of people in healthcare who are doing real and repeatable things that help children who are in crisis. They help us have better and more responsible artificial intelligence and better healthcare.
And I think that's it for.
Yeah, I think that's even more than 5 good things. So We're looking forward to seeing all of you next week and to make a positive impact.
Yes. Well, absolutely. And thank you, Janae. And thank you to our listeners. We look forward to welcoming you at Health Impact, and certainly tune in next time for our next Health Impact Live and Digital Health Talks. That's Megan Antonelli signing off.